You learn so much. They share so much of their life with you because they have seen so much in life. So, okay. So now to begin with the topic. Now, who are these seniors that we are talking about? We all know over the age of 60, we consider them senior. But who exactly are these people? They're actually people who have worked hard all their life, struggled to give their family the best they can. So it's only fair that we take care of them now. Now, why should we take care of them? Well, like I said, they've struggled all their life. So in the process, they have lost the agility that they had at one time. They have lost that quickness of mind and body. They find it difficult to do even the simplest of things. So they deserve our help at this stage. Now, is caring for them difficult? Like I said, it's a delight, trust me. But again, it can be a challenge. Why? Because unlike younger population, the symptoms of the disease manifest a lot differently in the elderly. So it's very difficult to diagnose what they're going through. And of course, there's a huge aspect of psychosocial in them which cannot be ignored and which needs to be emphasized to the best extent possible. Now, what do we watch out for? I said the symptoms manifest differently. How? Like a simple UTI, urinary infection, or a fever could manifest as confusion first, or irritability, forgetfulness, agitation, and any unusual behavior, like a person who would get up in the morning, do all his chores very independently and very quickly. Someday he just doesn't get up from the bed, and you don't know why. So instead of, most of us who are living with the elderly tend to get annoyed. Okay, what's wrong with this person? Why isn't he going out and getting the milk? Instead of that, I think we should change the way we think and think in the terms that maybe something is somewhere wrong with him and get him checked appropriately. How does physical therapy help in this whole process? Well, for one, as a physical therapist, my more emphasis would be on them getting their mobility back, getting their exercise. Why? I don't want them to run any marathons, but I want them to get their mobility, to get the activities done the way they were doing before. Like just going to the market, going to the hospital by themselves, or visiting their loved ones by themselves. They lose the sense of independence, and which means a lot to them. Today, we may not realize, but at one point when we actually lose it, we know how important that is. And it hits them very badly. So, my role would be to give that sense of independence back to them. And of course, exercise releases a lot of feel-good hormones, which makes them feel good, which makes them empowered. And when I do a group therapy session, they feel good to be with their own people who are going through the same stage of life. They share things, they do the activities with them. So it kind of engages them and takes out that loneliness part away. Most of the loneliness, depression in the elderly is unreported because they assume that people don't care about them. So when you make them exercise, make them do things by themselves, they tend to get out of that zone. Now, what will I keep in mind when I actually suggest an exercise program? First thing that I would keep in mind is what kind of lifestyle they had or they are having right now. Secondly, what they like to do and what they don't like to do. Because it's definitely not a good idea to push an elderly person to do something that they don't like. Come on, they've worked hard all their life. How much would you push them? So it's always important to keep their likes and dislikes